Cardiovascular disease, otherwise known as CVD, includes disorders of the heart and blood vessels. It is a concern for all Australians, but CVD impacts especially on Aboriginal and Torres Strait Islander people. CVD is the leading cause of death and responsible for a large part of the health gap between Aboriginal and Torres Strait Islander and non-Indigenous people. A national survey in 2018-19 found that 15% of Aboriginal and Torres Strait Islander people reported that they had a circulatory disease. While it tends to affect people later in life, CVD can occur at much younger ages for Aboriginal and Torres Strait Islander people than for non-Indigenous people. In 2017-18, almost 15,000 Aboriginal and Torres Strait Islander hospitalisations were attributed to CVD. These numbers have increased in recent years. In 2018, 12% of Aboriginal and Torres Strait Islander deaths were caused by heart disease. There are several types of CVD that impact especially on Aboriginal and Torres Strait Islander health. Coronary heart disease is the most common form of CVD. Another type of CVD of particular concern is cerebral vascular disease, a group of conditions that include stroke. Research has indicated that Aboriginal and Torres Strait Islander people who have suffered heart disease or a stroke may have poorer long-term health outcomes compared with non-Indigenous patients. Acute rheumatic fever and rheumatic heart disease are conditions where the majority of cases occur in the Aboriginal and Torres Strait Islander population and are related to social disadvantage and poverty. The latest statistics show that there were almost 1,800 diagnoses of acute rheumatic fever for 2013-17. 94% of all cases were of Aboriginal and Torres Strait Islander people. Following rheumatic fever, and if the heart is impacted, rheumatic heart disease can occur. Rates of new cases of rheumatic heart disease diagnosis were highest in the Northern Territory in 2017. Aboriginal and Torres Strait Islander people, particularly those who live in remote areas, often experience difficulties in receiving care for CVD. These issues include problems accessing care and medication, lower rates of investigation and intervention, as well as cultural barriers and past negative experiences of healthcare. Aboriginal community-controlled health organisations are well placed to address many of these issues. They can provide culturally appropriate care, encourage health checks, and provide access to Aboriginal and Torres Strait Islander health workers and practitioners. The good news is that more people are going for health checks. In 2017-18, there were 3 times the number of health checks at various health services than for 2010-11. While statistics surrounding CVD have generally improved, there's still much more work to be done to improve the outcomes for Aboriginal and Torres Strait Islander people. This includes reducing risk factors. Smoking is a risk factor for CVD, and rates are high in the Aboriginal and Torres Strait Islander population. However, recent good news was that less young people are now taking up smoking. Having a healthy diet is a protective factor for CVD, but a recent survey found that only 6% of females and 2% of males met guideline recommendations of 5 serves of vegetables each day. Improving socio-economic determinants such as income, employment and housing will also help reduce the extent of CVD in the Aboriginal and Torres Strait Islander population. Importantly, there is a need to improve the access to cardiovascular care, including specialist services and rehabilitation. There needs to be an authentic partnership with communities and health services, including the Aboriginal controlled sector. A continued focus is necessary on the determinants of health for improvement, prevention and management of CVD. There are currently positive steps, including a commitment to strength-based approaches, for example, the Closing the Gap Research Initiative. The emphasis is on authentic partnerships, co-design, community-led solutions, a strong evidence-based approach, whole of government, including state and territory approaches, and making it clear to everyone involved what is expected of them. For more information, visit our website.